जय जगन्नाथ. Good evening. शुभ संध्या. नीलाद्रो शंख मध्ये शतदल कमले रत्नसिंहासनस्थं सर्वालंकारयुक्तं नभघनरुचिरं संयुक्तं चाग्रजेन भद्राया वामभागे रथचरणयुतं ब्रह्मरुद्रेन्द्र वन्द्यं वेदनं सारमेशं स्वयन परिवृतं ब्रह्मदारो स्मरामि. परम कारुणिक अनंत कोटि ब्रह्मांडर मौडमणि कोटि कोटि ओडियांकर हृदयर आराध्य देवता समग्र विश्व चराचर षष्ठ आनंद कंद परमानंद सचिदानंद अखिल रसगन विग्रह विश्व वेदनार वैद्य देवाधिदेव श्री श्री जगन्नाथंकर चरण कमल रे अकिंचनर कोटि कोटि प्रणाम. जय जगन्नाथ. On this live webinar, I welcome all the viewers to this Google platform. Today, on 12th February 2023, the ROVER Ranger unit of Maharishi College of Natural Law is going to organize 140th National Webinar on the title, Epilepsy Does Not Take Away Your Right to Live. So, as you all know, we are having 139 webinars, and all the webinars are student oriented, and particularly it is for the empowerment of the student and staffs, particularly the teachers and the volunteers of Scouts and Guide and others. Respected Principal Dr. Nalini Prabha Mohapatra, the President of this live webinar, esteemed Dr. Kaliprasad Mishra, the State Chief Commissioner, Odisha State Bharat Scouts and Guide, and Vice President Bharat Scouts and Guide India, Revered Chief Speaker, Assistant Professor Dr. Debasish Panigrahi, the MD, Neurology, Department of Neurology, MKCG Medical College, BERHAMPUR, Master DIBYANSU, the COF, Devi Public School, Jharsuguda, and respected sir, professors, readers, senior faculties, other leaders of Bharat Scouts and Guide, Rover Ranger volunteers, friends, philosopher guide who have joined virtually from different parts of India, and respected media personnel. We all here to listen our chief speaker, Dr. Panigrahi. Prior to that, I would like to welcome, sir. Let us welcome virtually. Salute. जैसे थे. As all of you know, epilepsy is a chronic disorder, that is the disorder of brain, characterized by recurrent seizures or fits. The seizures are caused as a result of sudden excessive electrical discharges in the neurons, that is in the brain cell. In India, particularly in November 17, we observe every year as the National Epilepsy Day to create awareness about epilepsy. But today we organize this not only to know about epilepsy, but it is an endemic disease in many parts of the country where it affects the brain and causes seizures and fits. But today we'll learn from Dr. Debasish Panigrahi, who will explain us the various causes, the conditions, and prevention for epilepsy. We know more than 15 million people around the world suffer from epilepsy as per a rough estimation of World Health Organization. Congenital abnormalities, brain infection, stroke in brain, tumor, all these are some of the causes as we all know. But loss of consciousness, stiffness of muscles in various parts of the body, and sudden twisting in some of the causes, they are the some of the symptoms that are might one can experience if they have epilepsy. So let's listen from Dr. Debasish, the neurology expert, about the neurological disorder, which is characterized by seizures, fits, confusion, loss of awareness, fear, anxiety, and depression. So we'll listen to Dr. Debasish Panigrahi. Now, I'll request all my friends to join over here. I know many of you from outside Odisha. So, sir will speak in English, in Hindi, and for the Odia people also, sir can explain you in Odia. First of all, in the first part, we'll listen to Dr. Panigrahi. And when we have any doubt, please keep in mind or write it down in your books or in your notebook, and we'll ask in the last part of the program when you asked to give your questions at that time. So in between, we will just mute ourselves, mute our audio, video, everything, and we'll listen to Doctor. So it's a great pleasure on my part to welcome Dr. Panigrahi sir, who has given his kind consent, even if his busy schedule, and he joined over from BERHAMPUR, MKCG Medical College, and he will not only encourage us, but will enrich us with few guidelines. So here some of the friends are from St. John Ambulance Association. They are first aid lecturer, first aid examiners. So I'll request all of you, please mute yourself and we'll listen from sir, and then we'll ask question one by one, and better to write down on the paper. I mean, here in our chat box. So now I'll invite Dr. Panigrahi sir. Yes, sir. Sir, as you know, we are having here friends from different parts of India, different corners. So kindly encourage us with the speech. Over to sir. Yes, just a minute, sir. I would like to request one of our smallest, youngest boy, Cup, Mr. Dibyansu. Master Dibyansu, are you there?
Yes, ma'am.
Okay. I will be excused if you will not speak or you will not enchant the sloka. So over to Dibyansu. Afterwards, sir will speak to us. The floor is now with Dibyansu Padi.
Namaskar, ma'am.
Okay.
वक्रतुंड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा ओम कदाचित् कालिन्दी तटविपिन संगीत करबो मुदा नारी वदन कमला स्वाद मधुप रमाशंभ्रुब्रह्म मरपति गणेशार्चित पदो जगन्नाथ स्वामी नयन पथगामी भवतु मुझे साबे बेनु शिरसि पिंचम कटितटे दुकूलं नेत्रान्ते सहचर कटाक्षं विदधते सदा श्रीमद्वृन्दावन बसति लीला परिचयो जगन्नाथ स्वामी नयन पथगामी भवतु मे महाबोधस्थिरे कनकरुचिरे नीलशिखरे वसन् प्रासादन्त सहज बलभद्रेण बलिना सुभद्रा मध्यस्थः सकल सुरसे बाब सरदो जगन्नाथ स्वामी नयन पथगामी भवतु. Thank you, ma'am.
Okay, you're most welcome. Now, the floor is with Dr. Debasish Panigrahi. I'll be very happy to request all of you, please kindly mute your audio and video, all of you, so that we'll listen very carefully and there will be no disturbance. Yes, sir.
Am I audible?
Yes, sir.
Yeah. Good evening to all. Thank you for having me on this platform to share my knowledge about this epilepsy. So, before starting about epilepsy, I will tell in brief how our brain works, because epilepsy is a chronic neurological disease.
Yes,
If
sir.
you know how our brain works, then you will know why epilepsy occurs. Okay. So
Yes,
the
sir.
brain consists of various brain cells, which is called neurons.
Yeah.
And the neurons act by discharging electrical impulses. If due to any reason these neurons act abnormally and discharge abnormal electrical impulse, then it will cause fits. Okay. So
Okay,
when you
sir.
see a patient is having fits, it is called seizure. So why this neuron will act abnormally? There are many causes. Suppose there is a infection in the neurons. Suppose there is a injury. Suppose there is a stroke. Suppose blood sugar is decreased. Suppose blood sodium is decreased. There are a lot of causes. By in the final point is all these causes will cause this irritation of these neurons, and these neurons will discharge electric impulse abnormally, and the patient will have fits. So when you see a person is having fits, it is called seizure. So seizure is a generic term. So whenever any patient is having a fit, it is called seizure. So what is epilepsy? When a patient has 2 or more seizure, then it is called epilepsy. So if you even after all the investigation, you don't know why this fits has occurred, then only it will called epilepsy. Epilepsy means there are 2 or more fits and the cause is not known. So that is called epilepsy. If the cause is known, it is only seizure. There is no epilepsy. So now we focus about what are the causes. Why this epilepsy occur, or what are the causes of this seizure. So this seizure can occur in any age group, from a newborn child from day 1 to a elderly at 100 years of age. Anyone can have fits at any age, but the common is 2 age group. One is the pediatric age group, as we know, less than 14 years of age. In this age group, the seizures are very common, and another age is at elderly age group, more than 40 to 50 years. In these age groups, the seizure is very common, but mind it, the seizure can occur at any age, at any time, to any whether it is male or female, to any type of person. Okay, and that's why the causes are also different. Since the spectrum of seizure age is so much, the causes is also different for different age. Suppose for pediatric age, the causes are completely different. The commonest cause is Barth asphyxia. You may know this is the commonest cause in our developing countries, not in the Western countries. This is very rare. Barth asphyxia means whenever a child is delivered, and if the child do not cry, that is the most common cause of seizure. When it's generally all the child cry after birth, whether it is cesarean section or whether it is a normal delivery. Every child should cry. If due to any reason the child will not cry, suppose sometimes the delivery occurs 4 to 6 hours, the delivery do not progress as expected. So in those cases, what happens? Traumatic delivery will occurs and the child will not cry, and that is known as birth asphyxia. And those child will in the future at the same time or also in the future is going to have seizure. Second component cause is infection. Since the immunity power of the children are very less, so they are prone to have infection. And what happens when infection occurs in blood, that infection can go to brain, and the infection in the brain will cause seizure. Third commonest cause is if due to any reason, suppose a child is not eating well, is having hypoglycemia, means the blood sugar is decreased, then we will have seizure. Suppose a child is having diarrhea. Diarrhea is very common in children. So when the child is having diarrhea, he is not drinking any fluid or ORS or any salt intake is not there. So the salt concentration of the blood will decrease. So the patient will have a seizure. If there is any tumor in the brain, it may cause seizure. So there are a lot of causes of seizure in the pediatric age group. Another age group is the elderly. It is more than 14 years up to the cause of seizure is quite different in this age group. The commonest cause is like saying the trauma or head injury. Someone is riding a bike or a vehicle met with a road traffic accident, having a head trauma, and then seizure will occur in those patients. In not all those patients, but some of the patients will develop seizure at the same time or in the future also. Second is tumor. If they have any tumor in the brain, then it will cause seizure. Third one is the stroke. If the patient is having blood pressure, is having hypertension, or hypertension means increased blood pressure, or a patient is having diabetes, then they may have a stroke. And due to those stroke, the seizure can also occur. If a patient is hypertensive, that is a high blood pressure is there, and is not treating that blood pressure, that high blood pressure can itself also cause a seizure. If the patient has a diabetes, is not treating the diabetes, when the blood sugar will increase, then seizure will occur. If that patient is taking diabetic medication and the blood sugar will decrease, then also the seizure will occur. Okay. So similarly, when the patient is having an infection in the brain, a lot of infection can occur in the brain. And in the elderly age group, the TB, tuberculosis, may also affect the brain. In those cases, seizure can also occur. So these are some common causes of seizure, but the main point is only 50 to 60% of cases we know the causes of seizure. Rest 30 to 40% of cases we do not know any cause of seizure. That is known as idiopathic epilepsy. That means the cause of the seizure is not known, and this is the most common category. Okay, so now I have told about what is seizure and what are the causes and at which age group it will occur. Now I will tell something about the clinical feature. So how will you know the patient is having seizure? So the seizure can have a various different manifestations. There are some terms I will tell in the maximum simplistic way. One is one type of seizure is known as generalized seizure. What do you mean by generalized seizure? You have seen a patient. Some of you have already seen a patient of seizure. That is when when they are having the twisting of these hands. There is increased tone of these lower limbs, having deviation of the back, deviation of the mouth. There is uprolling of the eyeball. There is frothing from his mouth. There may be a tongue bite. They do not know. They may pass urine and stool on the spot also. So these are the common feature of the seizure. So when a patient is having a generalized seizure, that is it occur in all the limbs. Another term is a partial seizure. So what happens? All the things occur in one side only, either in the right side or in the left side. That is known as a partial seizure. Another seizure is the atonic seizure. Suppose the patient is walking, he suddenly fall down and lost his consciousness. It is known as atonic seizure. Another seizure which is very common in the childhood in pediatric age group is known as absent seizure. What happens when the child is reading something or doing something, he or she suddenly stops doing that. Just there is a vacant stare, is just only looking in the front, not doing anything for 15 to 20 seconds, and after that started to do whatever he is doing. It is very common in the children. A lot of you may think it is the child is become absent-minded, but if episodes occur repeatedly, then you should seek a doctor. But because it may be a case of absent seizure. So these are the common types of seizure you can see. So these are the commonest clinical feature and common type of seizure you can see in your day-to-day life. So the next question being, what will you do when you see a patient of seizure? So with a patient, you are in the road or in the classroom or teaching students, when you see a child or a adult is seizing, what will you do? At first, bring the person to a safer place, because if he is on the road, he may fall down or the vehicles may run over him. So always, or if he is near a water or near a pond, he may fall in the water and drown in it, or if he is near the fire, he may got burned in it. So at first, the main thing is bring the person to a safer place. Then position him or her in a left lateral position or in a side position, because what happens when you put her in the side position, so if there is some frothing, some saliva comes out after the mouth, it will drain down, or if there is a blood come out, it will drain down, so the airway will become clear. Because when a patient is seizing, if there is some, the saliva will clog its airway and the patient may have difficulty in respiration, when patient may die. So put him or her in a lateral position and loosen all her garments. Okay, if there is any garment is present obstructing his airway, then loosen it. And the next important thing is what you should not do. You, a lot of time you will see the people are coming with keys or iron material to make them hold in your hands. Do not do those things, or do not put any water or any liquid material in the mouth, or do not try to open their mouth, because the patient or you both will get injured. And after doing this, just call the ambulance and take the patient to a hospital. Whether the seizure is stopped or not, you have to take the patient to a hospital, because the treatment of a seizure only can occur in the hospital. Okay. So when we receive a patient is having seizure, at first what we will do, we will see whether the patient is breathing or not, heart is working well or not, patient is having a normal blood sugar or not, or patient, the sodium status of the patient is normal or not. After doing that, we will do a imaging, which is known as CT or MRI of the brain, and we will start giving medication. Okay. The most common treatment and the most effective treatment of the seizure is the medication. A lot of medications are available in the commercially in the market, and also 24-hour available in all the hospitals. When we get a patient, we give them a anti-epileptic medication. These medications are known as anti-epileptic medications or anti-seizure medications, because they stop seizure. So we give them, if the seizure stops, after we give them by injection. Then after the seizure stops, we make them oral and discharge the patient with these oral medications. The most important thing is you have to ensure you have to take the medications which is prescribed in the exact same amount of dose regularly, because if you miss even a single dose, it may cause seizure. So the wrong compliance is the most important thing. So when a doctor prescribes any medications to a seizure patient, he or she has to take those medications regularly at the advised time. And when you take seizure medication, the seizure control, you have to take some precautions initially. Because you should do not take too much stress, too much anxiety. Always avoid too much anxiety, and always sleep regularly. 7 to 8 hour minimum sleep is required for all the patients. And during initial time, when we're not confident the seizure is controlled or not, avoid going to near water or fire. Okay. After seizure is controlled, there is no problem. And also avoid to going higher area or high ground areas. Okay. But after seizure is controlled, you will do exactly the normal works as your colleagues are doing. There is no problem in that. But always avoid stress, always avoid anxiety, insomnia. If you are taking some alcohol or smoking or any drug, substance abuse is there, completely avoid it, because even if you take these medications, if you take these drugs, then it will cause seizure. So take healthy diets, live a healthy life, do early morning or evening walks, and healthy lifestyle and healthy food is paramount importance in a patient of seizure. Okay. And these are the precautions every person should take. And if a children, there are some if a children is having a seizure, there are some job for his parents to also to do. There are some responsibility for the parents. The first thing is the parents should uh, so the parents should let their teachers know about this condition of the children, that my child is having a seizure, he is taking drugs, so that whenever the child is due to any unknown reason, if the child is having any seizure in the classroom, so the teachers can also give him the medications. Otherwise, you will not know what is happening to these children. So every parent whose child is having a seizure should inform their teachers about the condition of the child, so that they will act rapidly. So when seizures will occur. Second thing is never, whatever I said, never miss a dose. That the medication is very much important, and you should never miss a dose. And if the thing is, if you take medication regularly, if the seizure is controlled for at least 2 to 3 years, then the medication we can decrease and also stop, and the patient can live normally, just like a normal child. Okay, any child or any adult who is having a seizure, if taking medications normally, he can live just like a normal person without any restriction into his day-to-day work or in day-to-day life. And after taking 2 to 3 years of medication, if the seizure is completely controlled, we also can stop the medication, and the patients are living now very happily without any medications. There is no, in most of the, nearly 7 to 80% of cases, there is no long-term consequences of this having seizures. So this is most important in the rural areas, because when they are having seizures, they are having some social taboo. They do not inform that doctors about the seizure, and particularly in the women in adolescent girls in the marriage age, when they are getting married. Generally, what happens? The parents hide this fact that their girl is having seizure, but it is very much problematic in the future life, because the most problem that woman this girl will this married woman will suffer in future is when they will get pregnant. Okay, so if a married woman is having seizure and get pregnant and do not take medications, what will happen? When the patient is pregnant and having a seizure, she may fall down and she may have a miscarriage. Or if the seizure is not controlled, there may be a problem in the baby who is going to be born. But what happens when a married woman gets medicine? If the married woman takes medicines regularly, there will be absolutely no danger to the child, and the child will born normally, just like a normal child, and and the child is also going to have a very good life, because the seizure is, in most of the cases, not hereditary. It is not passed from parents to its children's. Oh, okay. So the most important thing is, if you are having a seizure, seek the help of your doctors nearby. Take the appropriate medications regularly, and inform the teachers and other close by relatives about his condition. Okay, so it is not a social taboo. Patient with having seizure will live just like a normal person without having a long-term consequences of this effect. So in brief, I have told about this seizure. If anyone of you having any doubt about this thing, you can ask me.
Yes, sir. Thank you, sir. Actually, I may request you, sir. I have requested all of you, means you also muted your video, so we are not able to see you.
Yeah, the video will distract the listeners about the
Yeah, I
actually
know.
ongoing topic. That's what
But
I am.
they are very much interested to see you. Few of them have written to me, sir, madam, we don't able to see doctor.
Okay.
It's really very good to see all this
Okay.
writing. So thank you, sir. Sunil ji, journalist online. Do you have any question? Namaskar.
Namaskar.
Which question है तो you can ask. Few of them also they have written, sir. They listen. They want to listen in Odia. Okay.
Okay, no problem. In whichever language you are comfortable, I will tell. No problem.
Yeah. So they have written their questions on the paper.
Okay.
In seizure, they want to know about the seizure in particularly in not in medical term, but also in day-to-day affairs. I mean, in general term, they want to know. although it is a excessive electrical discharge in the neuron, I mean brain cell, what is that electrical discharge? They want to know. So kindly,
in Odia.
please, yeah.
ओडिया तो मु जा कहली हमर मस्तिष्क अछि मस्तिष्क काम करिवार तर कोष गुडा अछि त कोति स्नायु कोष ए स्नायु कोष माने कोन करंती माने जो गोटे वैद्युतिक शक्ति थाए इलेक्ट्रिकल इंपल्स थाए तो द्वारा समान कोन करंती कार्य करंती तो गोटे स्नायु रो किछ गोटे इलेक्ट्रिकल डिस्चार्ज बारे ता द्वारा कि से अन्य स्नायु को से प्रभावित करता है एवं ता द्वारा सपोज एमती भाबंतु मु गोटे हाथ मु गोटे जिंस धरिया जाउची मो हाथ रे ठीक अछि सपोज मो ब्रेन रे गोटे जो स्नायु कोष अछि ब्रेन रे गोटे स्नायु कोष अछि जे कि से हाथ रे जिंस धरिया साहाय्य करियो तो सेही जगार स्नायु कोष कोन हुए एक्टिवेट हो जाए तो से स्नायु कोष गोटे इलेक्ट्रिकल डिस्चार्ज करे जा द्वारा कि मु से जिंसटा हाथ रे धर परिबी तो भाबंतु जदि सेही स्नायु कोष रे मु जतले भाबिली कि स्नायु कोष मु जिंस धरि बोली जतले स्नायु कोष एक्टिवेट हैला तो एपिलेप्सी पेशेंट मानर कोन हुए से भाबी नथि एक जिंस धरिए बेली से जस्ट बसिथिबे तो तांकर सेही जगह जदि स्नायु कोषटा जदि सपोज एक्टिवेट हो गला किछि धरिया नथले से मन धरिला पिरे हातरा करिवे बुझले तो सेहीडा को कहते एक्सेसिव इलेक्ट्रिकल डिस्चार्ज जते बडे तमरो गुडी स्नायु कोष काम करबा दरकार नाही सेते बे जदि सेटा काम करला ताऊ कहते इलेक्ट्रिकल डिस्चार्ज तो म खाली कहले हाथ धरिया विषय सपोज हाथ गोड़ सब गुडाकर जो स्नायु कोष गुडा काम करे समस्त मिसी की गोड थरे डिस्चार्ज करले तो सेगुडा को गुडे एबनॉर्मल मूवमेंट हुए ताको हम फिट मारिया बेली को सेते ना हाथ गोड़ हाथ छाटे गोड़ छाटे हाथ बंका हो जाए बेक बंका हो जाए डोला उठी जाए ए सब कोन ए जो स्नायु कोष गुडा थांती से कार्य करबा माने कंटीन्यूअस डिस्चार्ज करंती जेतले दरकार नै हम से डिस्चार्ज करबा तो से जो को हमर से बात गुडा को हुए और फिट्स को ओडिया बात कोहंती आ एपिलेप्सी कोहंती अपस्मार जदि गोटे लोक जदि बारंबार बात होला तो हम अपस्मार अछि बोली कहबा
राइट वेरी नाइस सर हमर सेंट्रल नर्वस सिस्टम और पेरिफेरल नर्वस सिस्टम दुईटा नर्वस सिस्टम काम करूची तो दुईटा जाकरे हमें ए माने दीज आर द बोथ द केसेस हमें पाउचे ना केवल सेंट्रल नर्वस सिस्टम
सेंट्रल नर्वस सिस्टम हमर अछि दुईटा ब्रेन और स्पाइनल कॉर्ड माने मस्तिष्क और तुलनाकांड ओके तो केवल मस्तिष्क रे असुविधा ले एमती हुए आ कोडी भी असुविधा किछि होनी
ओके
केवल मस्तिष्क रे असुविधा एटा तुलनाकांड असुविधा हो कि पेरिफेरल नर्वस सिस्टम हो एटा किछि हुए केवल मस्तिष्क असुविधा रे हुए
राइट सर एटा कोन माने आपण कहले एटा हेरिडिटरी नुह किंतु जेते बेले 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 पिला जन्म हला पर अल्प दिन पर एटा बाहरे हुए तो 15 वर्ष पर बाहरे हुए अल्प दिन भीतर बाहरे तो सेतरे किछि डिफरेंस अछि सर
हां हां अछि मेन रो हेरिडिटरी नुह माने मैक्सिमम केस हेरिडिटरी नुह किंतु 10 रो 15% केस हेरिडिटरी थाए जदि बापा मान जदि अपस्मार थाए त छुआ को अपस्मार होबार चांसेस थाए बट 10 रो 15% केस रे बाकी 50 रो 90% केस रे चांसेस न थाए कथार कहबार मतलब हला से आ ए छ माने केते बेले भी बात मारि पारे माने 2-3 मासरी बात मारि पारे किबा 20-25 वर्षरी बात मारि पारे तो तार किछि ठीक नहीं जदि बाप मांकर जीन को असुविधा जो जदि हेछि किंतु जदि गोटे छुआ जदि किंतु गोटे 10 दिन की 15 दिन की मासे छुआर फिट्स मारुछि आ गोटे 20 वर्ष छुआर फिट्स मारुछि तो दिजन कारण प्राय अलग थाए नॉर्मली 10 15 दिन भीतर जदि छुआर फिट्स मारुछि बेले मुजा कहली जदि छुआडा जन्म ले नथिबो किंबा देहरे मस्तिष्क रे इन्फेक्शन हे जाइतिबो किंबा ब्लड शुगर कमी जाइतिबो ए जो कारण जो ही ताको छुआ को बात मारे किंतु गोटे जदि 20 वर्ष जदि छुआ को बात मारे तबे तो ब्रेन रे गोटे ट्यूमर थाई पारे किंबा मस्तिष्क आघात हो पारे किंबा मस्तिष्क रे इन्फेक्शन हे पारे बुझले किंबा स्ट्रोक हे पारे ए सब कारण हला से कॉमन कारण
आगे
तो एतिमे कारण सब अलग बयस हिसाब
आगे आगे तो सिम्पटम भी सही अनुसार अलग हबो सर
सिम्पटम्स सही अनुसार अलग हबो सिम्पटम्स किंतु बयस अनुसार अलग हुएनी सिम्पटम्स ता को प्रकार फीड्स होची मु जनी कोड जनरलाइज सीजर माने सब हाथ सब गोड़ छाटिबो
आगे
आ गोटे तो समस्त जनरलाइज सीजर हे पारे छोट सक हे पारे बड़ लोक भी हे पारे एटा बयस के पारन को प्रकार फीड्स होची ता पर निर्भर करे गोटे मु जनी कोल जनरलाइज सीजर सब हाथ सब गोड़ छाटला आ गोटे ला पार्शियल सीजर तो कोन हमर गोटे पट डाहण हाथ की गोड़ नहले बाम हाथ की गोड़ को गोटे पट छाटिबो सेरा कोन पार्शियल आ गोटे मु तो कहली एटॉनिक सीजर जो लोकड़ा गोटे जाउतबो धड़ गिने चेता भारी पड़ जिवो सी
हां सेटा सर सेटा मेन केसेस
सब पड़ जिबा किंतु सीजर नुहे
ना
सब एमती धड़ गिने पड़ जिबार बहुत गुड कारण अछि तारो 15-20% केस रे सीजर थाए आ बळका 70 केस सीजर न थाए तार अन्य कारण भी उड़ाय अछि तो एमती विभिन्न प्रकार सीजर अछि बयस हिसाब
सर जेतेबेले रास्ता रे पड़ी जाउची बा गोटे बा पट साइड रे हैला आइदर सेटा स्ट्रोक हे पारे बा हमर सीजर हे पारे स्ट्रोक आ सीजर भितर हम केंती डिफरेंस जानिबा सर
तो जदि सपोज गोटे फिट्स मारछि स्ट्रोक होई कि भी पेशेंट को सीजर हे पारे बिना स्ट्रोक रे भी सीजर हे पारे जदि सबुदा हाथ गोड़ जदि फिट्स मारछि परे हम जानला से जनरलाइज सीजर टा बोली सपोज गोटे पट्टा जदि फिट्स मारछि स्ट्रोक रे कोन होय ना गोटे पट्टा पैरालिसिस हे जिवो हाथ गोड़ गोटे काम करबोनी से परे पड़ी जिवो पाटी पाटी बोली जिवो चार चेता भी पळे जाय पारे नौ जो पळे जाय पारे धीरे जाय पारे किंतु काम करबोनी फिट्स ले कोन अब छाटिवो हाथ गोड़ गोटे साइड रो जो छाटिला सेडा ला फिट्स जदि खाली पड़ी गला सेमती मूवमेंट कर परनी सेडा ला स्ट्रोक
very important point and sir one more question से जेतेबेले हमें स्ट्रोक होची सर सेटा कोची रेडिएट करूची लेफ्ट साइड को तो
अच्छा
हमें ताको सेठी कोन करिवा धरम तो रास्ता रे जाउची स्ट्रोक एला पड़ी गला सर हमें
अच्छा
आज ए फर्स्ट एडर हमें कोन करिवा सर
हां प्रथमे देखियो प्रथमे रास्ता रे पड़ी गला ताको गोटे प्रथमे सुरक्षित जगह को आनिबे
सर सेफ्टी
सुरक्षित जगह आनि तार ड्रेस ताको ढिला कर देबे ताको बां कड़ करी सुआई देबे बां कड़ करी सुआइले कोन हबो बहुत गुडा सीजर फिट्स मारल कोन होय पाटो लाळ बाहरी जाए किबा जीव कामुडी कि रक्त बाहरी जाए तो सेगुडा सब बोही जिवो साइड और नहले कोन हबो जो चीट करी सुआई बस सेगुडा को बोही पारिबोनी निश्वास नल रे पस जिवो निश्वास नल रे पसिल ना निश्वास बंद हो जाए एई सब जिंस लागि असुविधा हो एक्चुअली तो ताको साइड रे पर सुआई दबो आ बहुत लोग देखिचो लुहा धरांती चाबी काटी धरांती चप्पल सुगंती एगुडा मोटे करबोनी एगुडा करले असुविधा हो एक्चुअली पेशेंट रो आ बहुत लोग कोन करते पाटरे पानी देबो चेष्टा करते पानी भी देबे ए पुनी देले तेवडा पुनी निश्वास नली पळेबो निश्वास बंद हो जिवो
आज्ञा
खाली साइड को सुआई खाली साइड को ड्रेस बां पट को सुआई देबे तार ड्रेस में ढिला कर देबे आ फटाफट एम्बुलेंस को फोन करिवे कारण सीजर ट्रीटमेंट हॉस्पिटल रे हबो मोटे क्लिनिक रे किबा बाबा माने घरे हे परिबो नै ताको हॉस्पिटल जेमती नबा पड़िबो
सर सर हमें जो बापट को सुआउचे ताको 3/4 प्रोन पोजीशन में सुआइबा ना खाली सेमदी लेफ्ट साइड को माडी की सुआइबा
ना ना ता कोन करिवे बापट को सुआइबा माने तार हातरा को तार मुंड तले हाथ को रखि देबे बा हातरा को ता मुंड टिकी ऊपर को रहला डाहाण गोटे को भांगी देबे तो आंठुरा भांगी रहला
ओके 3/4 प्रोन पोजीशन
ता बा गोटे सीधा ही रहइबो तो से पूरा टोटल ता छाती तळु बाजिबोनी से पूरा बॉडी बस रिकवरेंट पोजीशन आराम से सोई बसी
आगे सर बहुत सुंदर सर बहुत बढ़िया नाउ आई कैन रिक्वेस्ट आवर पार्टिसिपेंट्स you can if you have any more questions you can raise your question unmute your video and audio and please ask okay so I think almost all the question has covered the final question which is the future so what should be the impact of this seizure on our future sir
एक्चुअली ओडिया कहबी इंग्लिश रे कहबी
सर ओडिया रे कोंतु भल लागुची
तो जदी मु जो कहली सीजर माने जो बात मारिबा अपस्मार अति बहुत बड़ जटिल रोग नुह मेडिसिन रे तार पूरा चिकित्सा संभव पूरा संपूर्ण रूपे टिके रो है तो बुझा कहली गोटे माने बात मेडिसिन द्वारा गोटे मेडिसिन द्वारा से संपूर्ण रूपे भल हो जाय पारे तो इंपोर्टेंट जिंस हला जो डॉक्टर आपन को मेडिसिन देबे सेही मेडिसिन देखो सेही डोज रे रेगुलर खाया पड़िबो केना सिंगल डोज मिस हेले भी बात मारिबार संभावना थाए किंतु इंपोर्टेंट कथा हला जदी सेही मेडिसिन 2-3 वर्ष कंटीन्यूअस खाइबो आ बात पूरा आ बात न मारिला तो मेडिसिन कमी बंद भी कर दो आ 70 80 भाग केस रा मेडिसिन दरकार पड़े नहीं भविष्य रे आ सेही लोक माने नॉर्मल जीवन यापन करती तार भविष्य जीवन उपरे आपणकर वैवाहिक जीवन किंबा आपणकर एकेडमिक परफॉर्मेंस किंबा आपणकर चाकरी क्षेत्र में कौन से भी केबे किसी असुविधा हुए नहीं किंतु इंपोर्टेंट है बहुत जल्दी जिते बड़े फिट्स बोले ट्रीटमेंट करंतु आ मेडिसिन खांतु आ मेडिसिन द्वारा संपूर्ण रूपे निराकरण संभव
प्रणाम सर आई हैव अ क्वेश्चन
कोंतु
सर प्रणाम सर मु रिसर्च स्कॉलर एवं सीएसयू पूरी सदाशिव कैंपस रो वर्तमान सर्जन विभाग रे रिसर्च कार्य करू अछि
ओके
एवं मोर प्रश्न थिला जो पैरालिसिस आउ जो अछि हमर बात मारिबे से को एका जिनिस ना अलगा अलगा
ना
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 ताके पार्थक्य कोन
पारालिसिस माने पक्षाघात होइजो माने गोटे साइड टा पूरा अचल होइजो बुझिलो पक्षाघात हला गोटे साइड टा अचल होइजो ब्रेन रे
आज्ञा
स्ट्रोक हेल स्ट्रोक बोली कहंती अपस्मार हला अचल होबनी अपस्मार हला हाथ गोड़ मुठा करी बात मारिबो जो बात मारिया बोली कहंती गां गां गंडा माने करे कि शहर माने करे पुडी छुआ बात मारथिबे हाथ गोड़ मुठा करी से बात मारिबो आ सेरा बात मारला परे से हाथ गोड़ सब नॉर्मल थिबो सेउडा किछ असुविधा होएनी किंतु पारालिसिस रे कोन हो ना गोटे पटा पूरा अचल होइजिवो से जगे पक्षाघात बोली कहंती दुईटा अलग अलग जिनिस किंतु एति होई पारे पक्षाघात गोटे लोक जदी पारालिसिस हुए ताको फिट्स मारि पारे किंतु सब फिट्स पेशेंट को पारालिसिस हो बोली से ग्यारंटी नो
हम माने मो आंकर ए जो हिटलर माने 10 मास तळे से कोन तांको माने गोढा तो माने माने उठी पार नथिला आ माने माने मुद्दा की पड़ी जाउथिले माने सेडा कोन माने बातर लक्षण ना पैरालिसिस रो लक्षण
गोड़ा तो पड़ी पड़नथला गोटे पट गोड़ा तो पड़नथला दुई पट
माने दुई पट माने टिके माने अकामी वाला माने हे पर
अरे
नथिले से
हाथ
पैरालिसिस
गोड़
को जिवो
अरे हाथ गोड़ अकामी पर बहुत कारण अछि खाली पारालिसिस ले जे खाली हाथ गोड़ अकामी से ता नु जदी गोटे
नहीं
पट जदी
से
अकामी
बेसी काम माने से बेसी काम करन दिते हस्तिबे
आ ठीक अछि काम करबा ठीक कथा जे कि गोटे पट पक्षे माने अचल हेले तक पारालिसिस कहबा दुई पट पक्षे
आज्ञा
ताले तक पक्षे हाथ कहबा तार अलग कारण भी थिबो बुझलो ना
आज्ञा
विभिन्न कारण रही पारे
सर
पक्षे तमरा सुषुम्ना कांतिर असुविधा हेले सही पारे तमरा स्नायु कोषर असुविधा हेले सुनो पारालिसिस होबडा जो अकामी हेइ जिबाडा 50 कारण अछि गोटे कारण नुह बुझलो अचल होबार जो
आज्ञा
कोच फिट सबर गोटे कारण से ब्रेन रो असुविधा होबा किंतु जदि पारालिसिस कोन माने अचल होबा ब्रेन रो असुविधा होबो सुषुम्ना कांतिर असुविधा होबो पेरिफेरल नर्वस सिस्टम जो कोन स्नायु कोषर असुविधा हेले पर जोड़े भी हे परिबो तो धीरे धीरे पूरा संपूर्ण जिनस पड़ी जिबा अकामी पड़ी जिबा अलग जिनस ये पूरा अलग जिनस पक्षे हाथ मारिबा अलग जिनस और फिट सब अलग जिनस पूरा संपूर्ण रूप अलग जिनस
यस सर स्नायु कोष दुर्बलता कहयो
आ स्नायु कोष दुर्बलता जे तार माने कारण थाए स्नायु कोष दुर्बलता भी एमति गोटे बड़ टर्मडा तार भी 40-50 कारण अछि बुझलो ना तो तार
आज्ञा
को
सर
कारण जो स्नायु कोष दुर्बल सेडे भी देखिया पड़िबो ना समस्त स्नायु कोष दुर्बल होएन ना किछ कारण थिले स्नायु कोष दुर्बल
Thank you.
थैंक यू
Thank
सर
you, sir. So there is, although we have proper standard operating procedure, that is SOP, for treating epilepsy, as we know from our doctor, the treatment might depend on the particular patient and the magnitude of the disease, but sir has told. But it is not hereditary, as he told. So we as a society should be more empathetic to such endemic diseases, and only then we can fight them effectively. The general public needs to put pressure on the authorities and the government to improve the health infrastructure so that we can fight epilepsy in the country as a whole. So this is all about the program, and we have learned a lot of things from our doctor. So for being with us, he has given a lot of time for us and his valuable time also. To remember us, we would like to present a small memento to our sir. Kindly acknowledge, sir. This is for you.
Thank you very much. And it is a fun to talk with all of you. So just remember, do not neglect if you are having epilepsy or any person. जदि तमर जदि फिट्स अछि कि तमर आखपाख लोक जहाँ भी जानी जदि फिट्स अछि ताको मेडिकल को पठांतु कारण वर्तमान गवर्नमेंट मेडिकल मान करे सब प्रकार सब सुविधा अछि ता टेस्ट करिवार ता ट्रीटमेंट करिवार सब प्राय हॉस्पिटल एमआरआई हिसालानी सब हॉस्पिटल ईजी हिसालानी तो हमर विभिन्न टेस्ट करते ओड पेशेंट जदि फिट्स तावे तो सब हॉस्पिटल वर्तमान उपलब्ध अछि केवल समान हॉस्पिटल पठांतु से बहुत भलो ट्रीटमेंट पाइबे मतलब होला थी
Sir, बहुत सुंदर. Today, everyone joined the program and everyone also interested to get a e-certificate. So this is the e-certificate. Please see. I'd like to request Dr. Muhammad Osama, the resource person who joined over here from the Department of School and Mass Education, Odisha. May I request Osama ji, will you please acknowledge your certificate from our guest? Okay. Thank you so much. Now it's time to extend a heartfelt thanks to our sir. What I can say, respected principal ma'am, respected KP sir, and all dignitaries and readers, speakers from different places. On behalf of you, on behalf of Rover Ranger Unit of Maharishi College, I, DR.NAMITA Pattanaik, the Assistant State Commissioner, Bharat Scouts and Guide, and the lecturers in economics, Maharishi College, would like to extend my gratitude to Dr.Debasish Panigrahi sir, who has enriched us with many, many points about epilepsy. We have no doubt a lot of problem to understand what it exactly. So today, Dr. Debasish sir explain us the various causes, various conditions, and irrespective of age, and how to prevent this epilepsy. We all have seen, we all have found many people just lying down on the road, whether it is epilepsy, whether it is due to unconsciousness for other reason. So we don't know. But now we have got some idea about the chronic disorder of brain, and which is nothing but the seizures or the fits. So thank you, sir. Thank you very much. And I would like to request you, sir, as and when we need your blessing, we need your suggestions. And some other day, we may request you, sir, please join us and encourage us through this online, because it is very difficult to left your place from BERHAMPUR and come down to Bhubaneswar or somewhere else. But this is the platform where everyone is here from different corners of India, and they listen to you. So it's my privilege, sir, once again, to extend a heartfelt thanks to you.
Thank you,
And
thank you very much. Thank you very
dear
much, and
family,
I will be always there to help all of you. Okay.
thank you, sir. Thank you, your family members also who spare you, sir, on this Sunday evening to be with us. So once
Okay.
again, may I request all my friends, if you would like to have a photograph with Dr. Sir, you can unmute your video, all of you, so that we can take a photographs. And I'll request Sir also to unmute his video. We'll have a photograph, and suddenly we'll close the program. May I request all of you, please unmute your video. And thanks to DIBYANSU PADHI. I'm sorry. Thanks to all of you, all the participants from different places who join over here. And thanks to DIBYANSU PADHI also. May I request all of you, please unmute your video at least, so that we can have a photograph. Salima ji, are you there? Salima ji?
Yes, I am here.
Thank you very much. Dr. Saab, हमारा friend Salima ji from Jammu and Kashmir. She is here.
फोटो उठाना टाइम में
Doctor, thank you so much.
And Sita ji from Bokaro. Yes. Vijaya Deka from Assam, Pune. And Satish ji from Jharkhand.
Thank you, ma'am. Thank you.
Thank you so much.
You have a very diverse. You have a very diverse audience. It is a
Yes,
very
sir.
pleasure to talk to all of you. Okay, okay.
Sir, actually, it has become a family, sir. We joined over since last 2 years. During
Okay.
the Corona, we had been joined together as a family, and we are doing 140 webinars till date.
Okay, okay. It is a very commendable job.
Yes, sir. Thank
Very
you.
commendable.
Sir, it's possible only for these people only.
Yeah. So
They have-
keep on doing these good works. Okay.
Yes, sir. And you will find many people. Some of them are doctors, some of them are government employees, some of them are student volunteers, some of them are professors in colleges, So it's really miracle, sir. Thank you very much. I'm going to close the recording.
Thank you.